3 years ago, and we're very excited about that relationship. Clearly, as you read about the Gulen Institute and you read about Fethullah Gulen, the values and beliefs of the Institute and Fethullah Gulen resonate very well and are central to the profession of social work, so it's a natural for us to have this partnership. This session is titled Substance Abuse in Youth, and what I'd like to do is move straight into introducing our three panelists, and they will present on the order of the card, and so what I will do is I will introduce our last speaker first, and then our first speaker last, whatever. It's the end of the day. We've all had a long day. I think you all catch what I'm doing here. Our last speaker will be Florencia Valdez, who's on my right. She's been a member of the LaSalle University's community since 1988. And central to this community's beliefs is the universal values of brotherhood, faith, and service to others. She is participating in teaching religion to the poor, specifically love and marriage, Catholic social thought, Jesus, the model of person, and ethic for life, among many other areas. She's also co-founder of the LaSalle University campus in Chihuahua, Mexico. She has studied in Mexico, the United States, and in Switzerland. She is multilingual, speaking Spanish, English, et vous parlez français, n'est-ce pas? Ah oui, c'est très bien. And she now lives in Chihuahua, Mexico, married with three lovely children. And conversation we had earlier this morning, you will find her to be an absolutely fascinating individual. In the middle, as an individual you met earlier this morning, Dr. William Martin at Rice University. Dr. Martin is the Harry and Hazel Chavin Professor of Religion and Public Policy in the Department of Sociology. And he's also a senior scholar in the James A. Baker III Institute for Public Policy at Rice University, where he has taught since 1969. And so in one of those moments I started calculating, congratulations on your 40th anniversary, which is this academic year. Professor Martin received his BA and MA degrees from Abilene Christian University. He graduated from Harvard Divinity School, and he also received his PhD from Harvard. During his 40 years at Rice, he's received numerous teaching awards, including a Lifetime Award for Excellence in Teaching. His articles, mostly dealing with various aspects of religion and popular culture, have appeared in many magazines known to us all: The Atlantic, Harper's, Esquire, Texas Monthly, and numerous professional journals. And his books include A Prophet with Honor, The Billy Graham Story, My Prostate and Me, dealing with prostate cancer. That is one I really do want to look for and read. And With God on Our Side, and his most recent book, With God on Our Side, The Rise of the Religious Right in America, which is, by the way, the companion volume to a 6-hour documentary miniseries of the same name, which aired back in 1996. And I do remember that, and it was quite fascinating when that came out. It was very good. At present, Dr. Martin teaches Introduction to Sociology, Criminology, Sociology of Religion, and Fundamentalism. And to my immediate right is Dr. Dale Alexander, an individual I know very well as he is on our faculty at the Graduate College of Social Work. Professor Alexander is Associate Professor in the college. He received his BS degree as well as his Master's in Social Work from Florida State University. He has a PhD in Counseling Psychology from the Ohio State University. He has a number of years of professional practice and work in mental health, in both military settings and health settings. His primary research interests are substance abuse screening, treatment and education issues with a specific focus on marijuana screening. His prior research focused upon primary health care, clinical and physician occupational stress issues, and he has threatened to do similar research on occupational stress related to being a dean of a college. And he's also done a great deal of work ranging from resident support groups with physicians, night call schedules, and specialty indecision. So it's a pleasure for me to moderate this panel, and I'll be giving them the hand signals. The hope is that presentations will be about 20 minutes each, and then we'll go into Q&A for the final 15 minutes before adjourning for dinner. So with that, Dr. Alexander.
All I need to comment immediately that there is a resemblance between Dr. Martin and Mr. Gulen. I kept looking at the picture, so if nobody else has seen that, I want to call attention to that.
When I visit Turkey, I'm often told that you look like my grandfather or my uncle or my father-in-law. It's been very fun.
We're sticking with the theme of social challenges. Cannabis, marijuana, hashish, hash, is not just a 21st social challenge, but I've discovered is going all the way back to the 11th century. So I'm going to be talking about from hookahs to bongs. And hookahs were invented in the 1500s in India, but perfected in Turkey as the Turkish water pipe in the 1600s. And I'm going to give you some history on this. I'm going to cover, whoops, what did I do? I'm not going to be able to get through all the objectives today, but I am going to talk about the Turkish Muslim Arabic context for cannabis, some of the prevalence of cannabis use in the U.S. and Turkey, and I'm probably going to spend time focusing on some of the culturally confusing messages that are out there about cannabis. This is going to be a debate that continues. It's going to be a debate for the kids that were here previously. And I will provide information or slides regarding the evidence of risks, as well as some of the data for non-risks. Just to let you know, the hookah has transferred to our culture. You can find hookah bars in New York. This one at the bottom is in Austin. It's prevalent during the Ottoman Empire. A little bit about hash history and some of the distinctions between pot, hash, and hashish oil basically have to do with the concentration of the psychoactive drug in that. All of these come from hemp, which is a worldwide weed that grows everywhere. Even in Kansas at Fort Leavenworth, where I was first inducted into the military, it grows on that area. It's used originally for rope and paper. So if you go all the way back to the pharaohs and the Ottoman Empire and the Civil War, the ropes and the sheets were made of hemp as well as cotton, but primarily hemp, which was cheaper. The word hashish is actually from the Arabic and means herb or dry fodder. It's been called a variety of names throughout. I've even discovered some of the slang names in pot, weed. When I went to a conference on cannabis in Dundee and introduced myself as Dr. Alexander, I noticed that some of them smiled, and I've later learned that Mr. Alexander is a slang term for pot in Great Britain. So my British colleagues got the in-joke, I did not. The medical use goes all the way back to the year 5000. They've actually found cannabis in shamans' tombs, 5 to 3,000 in China and other places. So the medical cannabis debate actually goes way back as well. It was used primarily before smoking and recreational use as a cooking device. So these are recipes that go all the way back to the 7th century, but that you find in a book that you can pull off the website now. It's eaten, drank, whatever device it gets into the bloodstream. The other thing I found fascinating is that the marijuana debate is not new. While the Quran officially forbids alcohol, which both conservative and progressive Muslims agreed promoted violence, the word intoxicant was open to interpretation by Quranic scholars. And one of the pro-debates was hashish promotes peacefulness, passivity. So it's interesting that we have that debate that went all the way back. The other thing that I found interesting is that the medical benefits were promoted back in the 7th and 11th century because cannabis as an anesthetic and a mind-altering anesthetic was perceived as safer than opium from poppies. Also non-lethal, interestingly enough. However, the debate that really kicked off in the 11th century, the conservative branch would say, wait a minute, it's unholy, unsacred to pray in an altered state. All of a sudden, the Sufi sect weighed in and basically said, we think that cannabis, hash, is a sacrament and a portal to prayer. So the interesting thing is that the Sufis at one time were disparagingly called by other Muslims hash eaters, and I can't pronounce the term, but you had this debate that was evolving throughout that era. The interesting thing is the cultural wars back then were heavily influenced by the Sufi mystics, the Sufi poets, and the Sufi theologians, at least by my reading, and this is my source for some of this, so I'm sure I lack information, but I've tried to substantiate it. So we are now in the 11th century, and the issues of ban or accept were going, and that resonates with the debate that you can find in the New York Times this past year, and I've got a reference for that. The first war on drugs was actually waged, that I could find, by an Ottoman emir in Egypt who attempted to stamp out hashish with the peasants by basically having the fields burned, beheading people, and pulling users' teeth. 5 years later, it returned. It wasn't effective, which gets to the whole issue of whether prohibition is effective or not. So you come down to these lessons for today regarding prohibition, penalties, pulling teeth, or treatment. And we still have those dynamics that are sort of weighing in on this issue. The reason I became clinically interested in cannabis is the whole issue of when does use, recreational use, which the government doesn't like, but when does use go over the cliff? Because I would receive referrals and they would say, no, they don't use out, well, they use a little bit of pot. And use a little bit, and when that became an issue was part of the dilemma. This is an Institute of Medicine slide that I think makes sense for a lot of substances, because basically it talks about abstinence, non-problem use, at-risk use, and then when you get into the clinical abuse and clinical dependence ranges. And the interesting thing is that cannabis ranges along all of these, at least as I've seen it clinically and at least as the evidence-based data would suggest. Similarly to alcohol in our culture, you do have some people that can socially drink, that collect wine, do not have a problem with it. Then you have some that move out into the clinical range where it becomes problematic. So I'm going to cover a little bit of this. I'm going to talk about the widespread prevalence of cannabis and some of the cultural, legal, scientific debates and some of the evidence of marijuana's risk. So I just want to give you a little bit of information about the prevalence of cannabis. The lifetime American usage of cannabis is about 41.0%. So about 40% of the population has inhaled, admits they've inhaled, at least on surveys, at least once or twice. You can see the 2008 data in terms of past year and past month use, about 10% of the population. You've got about a third of users, this is some older data, that use cannabis at least 300 times out of 360 a year. So the whole issue of what becomes a problem and when recreational goes over the cliff remains an issue. Just a couple more data points here. When people use, quote, illegal substances, about 57% of that is cannabis only in our culture, and then 18% with. So you get about 70-some% that use cannabis. In terms of past year initiates, people are more likely to start using cannabis than other substances. This does leave out tobacco, by the way. Age-wise, this is a substance that is used more